Hey everyone, welcome back to Dr. Mohanomics, your friendly guide to understanding health and science in the simplest way possible. Today, we are going to talk about a topic that might sound a little scary, but don't worry, we are here to break it down for you in a simple, friendly way. We are talking about a colon cancer. What is it? How does it affect us? And most importantly, what can we do about it? Let's get into it. First thing first, what exactly is colon cancer? Well, your colon is a part of your large intestine and it helps your body process waste. Colon cancer happens when cells in the colon start growing uncontrollably. It usually starts as small growth called polyps. Now, not all polyps are dangerous, but some can turn into cancer over time. That's why regular screening is important, which we will talk about later in the video. So, how do you know if something wrong with your colon? The tricky thing is, in the early stages, there might not be any symptoms at all. But as the cancer grows, here are some things you might notice. Changes in the bowel habits. You might start noticing diarrhea, constipation, or changes in the stool consistency that last for more than few days. Blood in your stool. This is a big red flag. It might look bright red or even darker, almost like a tar. Persistent abdominal discomfort. Think cramps, gas or pain. Unexpected weight loss. Losing weight without trying. That's a common warning sign. Fatigue and weaknesses. If you are feeling more tired than usual, this could be a sign of a colon cancer. Of course, these symptoms can happen for a variety of reasons, but it's always a good idea to see a doctor if you are experiencing any of this, just to be safe. Okay, now let's talk about who's more likely to develop colon cancer. Some of the risk factors include age. Most people with colon cancer are older than 50. Family history. If your close relative have had a colon cancer, your risk is higher. Diet. A diet that's high in red meat and processed food might increase your chances of colon cancer. Smoking and alcohol. Both of these habits can make colon cancer more likely. Sedentary lifestyle. Not moving around enough can raise your risk too. But remember, having this risk factor doesn't mean you will definitely get colon cancer. It just means you might want to pay extra attention to your health. Now, here's the good news. There are steps you can take to reduce your risk of colon cancer. Let's keep it simple. Eat a healthy diet. Focus on foods that are high in fibers, like fruits, vegetables, and whole grains. Fiber helps keep things moving in your digestive system, which is good for your colon. Stay active. Regular exercise doesn't just help your heart and muscle, it helps your colon too. Trying to get at least 30 minutes of physical activity a day. Don't smoke or drink too much. Cutting down on alcohol, quitting smoking will improve your overall health and reduce your risk of colon cancer. Get screened. Colon cancer screening usually starts around age of 45 to 50, depending on your risk factor. A colonoscopy might sound intimidating, but it is a life-saving tool that can catch cancer easily, even before symptoms start. Alright, so what happens if your doctor thinks something might be wrong? How is colon cancer diagnosed? The most common test is colonoscopy. In this procedure, a small camera used to look at the inside of your colon. Sounds scary, but it's usually done while you are asleep or sedated. If a doctor finds polyps during the procedure, they might remove them right then and there. Those polyps will then be tested for cancer. Other tests might include blood tests or imaging scans like CT scans. Now, let's say colon cancer is found. What happens next? Well, there are different treatment options depending on how advanced the cancer is. First one, the surgery. If the cancer is in early stages, surgery to remove the tumor might be all that's needed. Chemotherapy. This involves using drugs to kill cancer cells. It's often used if the cancer has spread beyond the colon. Radiation therapy. This uses high energy rays to target and kill cancer cells. It's not as common for colon cancer but might be used in some cases. Targeted therapy. These are new treatments that focus on specific cancer cells, leaving healthy cells alone. Your treatment will depend on what stage the cancer is in and what your doctor thinks is best for you. After treatment, the journey isn't over. Many people live long, healthy lives after colon cancer. But it's important to take care of yourself. That might mean follow-up visits with your doctor, making lifestyle changes, and paying attention to your body. One of the most important things to remember is that early detection saves lives. So get screened regularly and don't ignore the symptoms. So that's the colon cancer in a nutshell. Thanks for watching. I hope this video helps you understand it better and reminded you how important it is to take care of your health. If you learned something today, make sure to hit that like button and subscribe to Dr. Mohanomics for easy to understand and health information. So stay healthy, stay safe, and I'll see you in the next video. Until then, goodbye.